Well, I worked in an HIV clinic when I was in Baltimore, Maryland. I was at the University of Maryland for 10 years, and I worked in an HIV clinic. I was an infectious disease pharmacist, and I help patients manage their medications within that setting. They have a lot of comorbidities, and so they're on multiple drugs. Not only their antiretroviral or their drugs for HIV, but they also had hypertension, or they had other kinds of diseases, diabetes, and my job was try to help simplify their medication. And back then they had to take many drugs for their HIV disease. Now it's much simpler. And so I helped the patients manage that and make sure they took them according to what they should be taking them for, and taking them appropriately and adhering to the regimen. I had one particular patient in this clinic that I'd like to share about. Okay, this, for privacy's sake, I'll call her Vicky. And she was an African-American lady, and she had AIDS and had had it for quite some time. And actually she had a daughter that was born after she had AIDS, who also was born with HIV. And she had failed many regimens, mainly because she just quit taking her meds off and on. And finally she came into clinic one day and she says, well, I think I'm serious about getting treated now, but I don't like to take medicines, and I want to be very simple in how I take them. I don't want to have something I have to take many times a day and that sort of thing. And so I worked with her provider, and we came up with a regimen that seemed to work best for her, what could be work best for her, because she had been on several other medications, so she had developed some resistance to some of them. So we had to come up with one that was going to work, and one that she could take no more than twice a day, preferably once a day. And she had some other things she had to take along with that. So we set up with a regimen, and then I worked with her. I had her come back and see me every week for quite a while, and she'd come back in the clinic and we'd work on her compliance with her medication regimen. I used pill boxes and have her bring her medicines in so I could see if she really took them like she said she did. And she had her mother at home with her for a while to help her, to remind her to take her medicines. And I'd call her on the phone once in a while, see how she's doing. But I made sure she came in and saw me at least every week for the first several months. And I saw her over a period of a couple of years. And she had a nurse practitioner she worked with as well. And she got better. I mean, she really did. She improved a lot. She was really down. She was on death's doorstep when we saw her. And she turned around because she decided, the constant carrying, I think, of my attention to her medication needs, she was serious about it and continued to take her medications. And after a year or two of this, and I had students that came into the clinic that worked with me on a rotation basis from the School of Pharmacy. And one day I went in with a student. I always went in with them when they interviewed the patient, and she agreed to be interviewed by the student. And she told the student, she says, well, it's because of me that she was alive. She said, if he hadn't taken the time to work with me on a weekly basis, I would be dead now. So it made me feel good. And she told the student that. So telling the student, so you do the same thing. You work with your patients and help them understand their medications and what they need to do with them. I think it's important that pharmacists are providers so that they can provide complete care to individual patients and continue to communicate with other members of the healthcare team. That's very important too.